Good morning everyone. This is J.Merlin, Assistant Professor, Department of Nutrition Dietetics, the Standard Fireworks, Rajaratnam College for Women. Warm greetings to everyone. Today we are going to see about what is fever and what are the needs, that is dietary needs for the fever, and how to overcome that problem, that nutritional status. So while in this course, therapeutic diet and counseling, while studying this course, the students can able to summarize the concept of diet counseling, assessing the patient's need and prescribe appropriate diet, symptoms and causes of various disease, identify the etiology, symptoms of various disease, disorders and suitable dietary modifications for various disease and generic disorders, and they can able to plan diet for various disease condition, and they able to interpret the principles of diet and nutritional requirement of various diseases and create a sample diet chart for various disease conditions. Let me enter into the topic, that is fever. So fever, it is an elevation of body temperature, but it may be by bacterial or viral infection accompanied with infectious disease and illness. It may be due to the antigen antibody reaction while entering the bacteria and virus into the human body, or maybe malignancy, or due to the graft injection. Then the fever can be produced by a group of either endogenous or exogenous substances called pyrogens. So pyrogens are not microorganisms, that is viruses and bacteria. So infections is invasion of body by harmful organisms such as bacteria, fungi, protozoa and or viruses. The infective agent may be transmitted by a patient or a carrier in airborne droplets expelled during coughing and sneezing or by direct contact. So it may be exogenous, it may be caused by exogenous and endogenous microorganisms. Maybe exogenous, external microorganisms, that we once a bacteria or viruses that comes from the our circumferences, it called as exogenous pyrogens. While entering the some microorganisms invade our body and sleep, it will in sleep consistency, it was called as endogenous microorganisms. So exogenous pyrogens derive from microbes and the toxins which stimulate cells found in this immune system to synthesis endogenous pyrogens or cytokines. So exogenous pyrogens may be products mycotoxins in our body. This cytokine subsequently induces the production of prostaglandins E2, that is PGE2. It will cause peripheral vasoconstriction and increase the metabolism and muscle contraction, which all lead to rise in body temperature. So once we tell the increase in metabolism, it may be energy metabolisms or protein or fat metabolisms. So fever may caused by in this image we can analyze how the fever can produce. So once the infectious organisms invade our body, it may be due to or bacteria or fungi. It is active. It will activate of phagocytes in the bone marrow, and it will release the pyrogens, that is fever inducing hormone, and it will synthesize the prostaglandins E2, and it will reaches the thermoregulatory center in anterior hypothalamus in brain, and it will increase the body temperature. So there are more types of fever in our country, that is short term duration fever, chronic fever, intermittent fever. So in short term duration, it will include cold, tonsils, influenza and typhoid. In chronic fever, it may be tuberculosis and AIDS. So while we said intermittent fever, it will indicate the malaria fever. So effect of the fever and infections. So fever affect our normal metabolisms of our nutrition and regulation of our human body process. So first one is impaired appetite. At central level, a transit reduction in plasma levels of micronutrient like zinc, increase in circulating interleukins during acute infections could possibly impair the appetite. In some infections such as gastroenteritis, vomiting and abdominal pain are obvious causes the impaired appetite. So second one is impaired impaired absorption. So when a person subjecting for a impaired appetite, it also causes the impaired absorption. There is poor absorption of fat, protein, carbohydrate and certain fat soluble vitamins like vitamin E and A during the infections, and fat and protein metabolism is altered, and fecal fat protein loss may be 20 to 40% with infections. Loss of nutrients may occur with vomiting and diarrhea. So the next one is increased requirement. So due to the impaired absorption and impaired appetite, we simultaneously we record the nutrient content increased level. The caloric requirement is increased as much as 50% if the temperature is high and tissue destruction is great. So we already know we have increased BMR during the fever conditions. Overcome the metabolism impairment, we have to increase our energy intake through soft diet and bland diet. So next one is drug and nutrient interaction. The primary task in caring the infected person, infectious patient or person, is to identify and eliminate the invading organism. Often physicians prescribe anti-infective agents. These drugs may alter the nutrient status. Nutrients may also interfere with drug effectiveness. Increased blood loss during some infections, maybe it will increase the metabolism level and increase the BMR level, and severe infections it will lead to internal organ corrosion. It will lead to the increased blood loss. So this is the general dietetic consideration followed for the common fever or infectious patient. So first one is energy level. Basal metabolic rate increases during infections and fever, and calorie requirement increases. Restlessness also increases the calorie requirement. Initially the patient may be able to ingest only 600 to 1200 kilocalories daily, but this should be increased as rapidly as possible. So the next one is protein. About 100 gram protein or more is prescribed for an adult when fever is prolonged. This will be most efficiently utilized when the calorie intake is liberal. High protein beverages may be used as supplements to the regular meals. So the next one is carbohydrate. Glycogen stores are replenished by a liberal intake of carbohydrates. Glucose, which is less sweet and readily absorbed into the bloodstream, is preferred. The next one is fat. The energy intake may be rapidly increased through the judicious use of fat, but fried and rich pasties may retard digestion unduly. The next one is minerals. So if sufficient intake of sodium chloride is accomplished by the use of salty broth, soups, and by liberal sprinklings of salt on food. Fruit juices and milk are relatively good sources of this element. At the onset of an infectious, blood iron rapidly declines as iron moves into the liver for storage. This shift helps to fight the infections by depriving the infective microorganisms of the body's iron, which they require for their metabolisms. Without medical intervention, the liver will return iron to the blood as the infectious resolves. So the next one is vitamins. Fever apparently increases the requirement of vitamin A and ascorbic acid, just as the B complex vitamins are needed at increased levels proportionate to the increase in calories. Oral therapy with antibiotics and drugs interfere the synthesis of some B complex vitamins by intestinal bacteria, thus necessitating a prescription for a vitamin supplements for a short time. Definitely we have to increase the vitamin intake because due to fat metabolism interruption, some fat soluble vitamins doesn't absorb by the human body. So overcome this problem, we have to increase our fat soluble vitamins increased level. So the next one is fluid. The fluid intake must be liberal to compensate for the losses from the sweet and permit adequate volume of urine for excreting the waste. Daily 2500 to 5000 ml is necessary, including the beverages, soups, fruit juices and water. Dehydration is usually not a problem unless a person has diarrhea, vomiting or excessive sweating. Giving fluids in these cases can cause fluid and overload. The next one is how to promote the digestion of fever or infectious conditions patient. We have to give them a bland or readily digested food should be used to facilitate the digestion and rapid absorption. The food may be soft or of regular consistency. Fluids diet can be used initially. If it is continued, there are disadvantages. Most fluid diets occupy bulk out of proportion of their calorie and nutrient values, so that reinforcement with solids is essential. A liquid diet sometimes increases the abdominal distension to the point of acute discomfort. Various solid foods may be better tolerated. Many patients experience less anorexia nervosa and vomiting when they are taking solid foods. As they have the increased BMR, so we have to increase our meals intervals 2 to 3 hours. We can give one meal between the 2 hours. The next 2 hours we can give the liquid foods or semi-solid food. Thank you so much for watching this video.